Welcome to this essential masterclass on the new Mental Health Act. If you have a child with autism or a learning disability, the legal landscape has just been completely redrawn, and it's been redrawn in your favor.
And I want to be clear, this isn't just some minor update. What we're talking about is a radical shift in thinking. It's about creating brand new rights and powerful new protections that are all designed to do one thing: keep children out of hospitals and make sure they get the support they need right there in their own communities.
I mean, just listen to that. That quote really gets to the heart of it, doesn't it? This is the fundamental principle of the new act. The law is now officially saying that a hospital ward is not a solution. It's not a substitute for proper support. The entire focus has shifted away from detention and towards prevention.
So the goal for us here today is to give you a clear, actionable toolkit. Seriously, by the time we're done, you're going to understand exactly how to use the 2025 Act to block an unlawful detention, to demand the right support, and to be the most effective advocate you can be for your child.
Okay, let's dive right into what is probably the single biggest change that the 2025 Act brought in. We're talking about the new rules around detention for treatment, what's known as a Section 3. And trust me, this is a complete game changer.
So here's the absolute bottom line. Under this new law, your child cannot be detained for treatment under Section 3 simply because they're autistic or have a learning disability. That's it. Full stop. The Act makes that explicitly clear. For a detention to happen now, there has to be something more.
So what is that something more? Well, the law gives it a specific name: a psychiatric disorder. And that is the new legal test. It means that for a child to be detained for treatment, clinicians have to prove that there is a separate, co-occurring condition that's distinct from their autism or learning disability.
And you know what? For a child with a learning disability, the bar is set even higher. It's no longer about the diagnosis itself. It's about very specific conduct. The law links detention directly to behavior that is, and I'm quoting here, abnormally aggressive or seriously irresponsible. The whole focus has moved away from the label and onto the immediate risk. Now, what's really fascinating is how the Act doesn't just block old practices. It builds a whole new process designed specifically to find alternatives to a hospital bed. It's your new power tool, and it's called the Care, Education, and Treatment Review, or CET Review for short.
And a CET review is not just another medical checkup. Just look at this list. Its purpose is deliberately wide. It actually legally forces the health service, the local authority, and the education services to all get in the same room and figure out how to meet all of your child's needs, whether that's the right school place, a proper social care package, or the right medical treatment, right there in the community. And get this whole process isn't optional. If your child, who's under 18, is detained or even just at risk of it, a CET review is mandatory. And notice those deadlines. They are strict. This isn't some vague promise of a meeting someday. It's a powerful tool with legal timelines that you can use to demand action fast. 14 days, that's the magic number. It is non-negotiable. It's written into the law. You can and you should hold services to this 14-day deadline. It is your right and it is their legal duty. This whole time frame is designed to stop children from getting stuck in places that aren't right for them. Okay, so let's look at how all these changes start to build a system that is legally required to be proactive. It's a huge shift from just managing crises to actually preventing them. And you, the parent, are placed right at the very center of it all.
So, under the new Act, the local NHS bodies, they're called Integrated Care Boards, have to keep a register of children with autism who they think are at risk of detention. But it's not just a list for gathering data. Being on that list triggers a legal duty to divert. That means health and local authorities are now legally obligated to provide the right community services to stop that child's needs from ever escalating into a crisis. The old, often confusing role of the nearest relative is gone. Thank goodness. It's been replaced by the nominated person. And for a child under 16, a parent is the default. But this is so much more than a name change. This new role comes with real power. You now have a statutory, legally protected right to be consulted, and, critically, you have the right to object to an application to detain your child.
So this all sounds great in theory, right? But what happens when services fail? What if the care is poor? What are the actual consequences? Well, the 2025 Act introduces some really powerful new legal tools to enforce these rights and hold every single provider accountable.
And I want you to know, these powers are very much active right now. A legal directive, it's called a statutory instrument, brought these new accountability measures into full force on April 6 of this year. So, The act now has real legal teeth.
Now this is a landmark change. It used to be incredibly difficult to hold private hospitals accountable for human rights issues, but not anymore. If a private clinic is providing care that's funded by the NHS, it is now legally considered a public authority when it comes to the Human Rights Act.
So what does this actually mean for you? It means you have real legal leverage. You can take direct legal action against private providers if they breach your child's human rights. It also means there's much greater oversight, with a new duty to review the rules for notifying the Care Quality Commission every single time a child is admitted anywhere.
And finally, let's look at how the Act strengthens your child's own voice in their care. This really reinforces the core principles of choice and autonomy that you see running through this entire new law.
The Act really shores up the status of something called advanced choice documents. This basically allows a child, if they're able to make these decisions, to formally record their wishes and feelings about any future treatment. So if they later lose the ability to make those decisions, this document ensures their voice is still heard. Clinicians have to consider it.
So, I know that was a lot. Let's just summarize the most crucial points. Think of this as your new checklist of powers. 1. Know that autism alone is not grounds for a treatment section. 2. Demand that CET review within 14 days. 3. Exercise your rights as the nominated person. 4. Use the Human Rights Act. And 5. Empower your child's voice with an advanced choice document.
You see, this legislation really is a turning point. The law has changed from a system that could just impose decisions to one that requires collaboration. The power to advocate for a future that is centered on community, on education, and on dignity, that power is now firmly in your hands.